cystoscopy is a medical procedure that allows healthcare professionals to examine the inside the bladder of a patient. It is usually carried out by a urologist in the specialized settings. It is useful for diagnosing the causes of certain symptoms and for treating various bladder conditions. It is a common procedure that a healthcare professional must know, as many of the patients may want to know if they have any condition requiring the need of cystoscopy. The procedure involves inserting a long, thin tube with a small camera, known as a cystoscope, through the urethra into the bladder. The urethra is the channel that carries urine from the bladder out of the body. Now, let's talk about the anesthesia options available for this procedure. Cystoscopy can be performed under local or general anesthesia. During a cystoscopy under local anesthesia, patients receive local anesthesia to numb the area around the patient's urethra or the lower part of their body. Alternatively, this can be carried out under general anesthesia, which puts them to sleep during the procedure, may be used. Each option has its benefits depending on the specifics of the case and the patient's comfort. Cystoscopy is performed for several reasons, including diagnosing bladder symptoms such as blood in urine, urinary tract infections, urinary incontinence, persistent pelvic pain, painful urination, frequent urination, or a feeling of incomplete bladder emptying. It's also used for treating bladder conditions like removing bladder stones, shrinking the prostate if enlarged, injecting medications like Botox for overactive bladder, repairing bladder damage, and taking cell samples for biopsy. Additionally, it plays a crucial role in checking for and treating bladder cancer by performing biopsies to detect bladder cancer, removing bladder tumors, and monitoring the effectiveness of treatments like chemotherapy. Preparation varies depending on the type of cystoscopy patients are having. There are two main types: flexible cystoscopy, which uses a thin, flexible tube with a camera and is typically used for diagnostic purposes. On the other hand, rigid cystoscopy uses a straight, non-flexible tube with a camera and is often used for treatment procedures. For a flexible cystoscopy, it's typically done with local anesthesia, and the patient can eat and drink normally on the day of the procedure. Preparing for a rigid cystoscopy may involve general anesthesia or spinal anesthesia. Patient might need an assessment appointment before the procedure. Fasting for several hours before the procedure is usually required, and it's important to arrange for someone to take the patient home and stay with them at least for 24 hours post-procedure. Before the procedure, patient will need to empty their bladder and possibly provide a urine sample to check for infections. During a flexible cystoscopy, patient will need exposure from the waist down, and they will be covered with a gown. Patient is then laid down on a couch or bed. Local anesthetic gel is applied to numb the urethra. The cystoscope is gently inserted through the urethra into the bladder. A saline solution is pumped into the bladder to inflate it for better visibility. The bladder is examined, and if necessary, a biopsy can be taken. The procedure typically takes 10 to 15 minutes. During a rigid cystoscopy, general or spinal anesthesia is administered. The cystoscope is inserted through the urethra into the bladder. Saline solution is used to inflate the bladder. Biopsies or treatments can be performed as needed. The procedure usually lasts around 30 minutes. After a flexible cystoscopy, if everything goes as planned, patient can go home immediately. Resume work and normal activities when they feel ready. After a rigid cystoscopy, patient can be discharged home after recovering from anesthesia and once able to urinate. Patient must have someone to drive them home and stay with them at least for 24 hours if they had spinal or general anesthesia. They must be advised to avoid alcohol, driving, and operating heavy machinery for 24 hours. Mild blood in urine and pain during urination may occur for a few days. Over-the-counter pain relievers like paracetamol or ibuprofen can help. Advise the patient to contact their GP if those symptoms persist beyond a few days. This detailed information about cystoscopy helps patients understand the procedure, its purposes, preparation, execution, and post-care expectations. you.